All right, everyone. Welcome to the first weekly MMI. Can everyone hear me? Perfect. So, for most of you, this is the first time here. We did have a session before, a while back before interviews were released. So this is the first official weekly MMI. So welcome. My name is Leah. I'm the creator of MedCoach. And we started in 2012 because I realized that a lot of people don't have connections to the medical side, and just speaking to somebody and hearing from someone who has gone through the process can be very beneficial. So that's why we're here, and not only do we coach, but we coach for charity. So thank you for supporting our cause, and this year we're probably going to donate to Head and Hands, which is a Montreal organization that we donated to last year. Okay, so first of all, congratulations to all of you. If you're here, it's because you have an interview. So that's already a huge step. So the MMIs are, they've changed over from the normal interviews. What's a normal interview? So one-on-one, standardized questions. And why did they do this? Because they figured out that by putting you in a room without any preparation and having you go in a situation that you've never been exposed to, they can figure out your personality much better and figure out what kind of person you are. Because it's much easier to just rehearse an answer and come up with the right answer on a question versus having to act out a situation. So that's the first thing you should know about the MMIs. And I'm going to go through a bunch of general tips, and then we will go through a sample scenario. So let me make this full screen first of all. Okay. Can everyone see the screen? Perfect. Okay, so here's some general tips. You're going to be put in a scenario that you have never been in before. You might be with an actor who is very believable because they're pros and they're hired to be an actor, and that's what they do. So they're good at what they do, and they will push your buttons. They will make you feel sad. They'll make you feel happy. They'll make you laugh. They'll make you feel empathetic. And that's all what they're testing in the MMI. So just remember that you should always be flexible and be polite, no matter what happens. Because some of the scenarios, you'll get someone who is very angry at you for whatever reason, that's part of the scenario, and they'll start yelling at you and they'll start trying to insult you. And just remember that you shouldn't let that bother you. Okay. The second thing you should know is the MMI is all about how well you know yourself. So basically, how you come across to other people. If you're someone who's very closed with your body language, or you come across as demeaning or belittling to other people, and you don't know that about yourself, then you're not going to do very well in the MMI, because a lot of these scenarios are about communicating and being nice and empathetic. So try to talk to other people and say, look, honestly, do you think I'm offensive? Do you think I'm rude? Do you think I'm arrogant? And look at yourself in the mirror, record yourself, and see how you act and say, if I was someone looking at myself, would I be offended by myself? Would I be turned off? Would I be scared? And try to be aware of your movements and aware of your emotions and your body language, and make sure you're just calm and confident and zen. And that's a big part of succeeding in the MMI, is being able to control how you portray yourself. Once again, don't react back to rude actors. They're only acting, so don't take anything personally, okay? A lot of people go in the room, the person starts yelling, they get offended, and they start yelling back. And that's not the point of the scenario. The point of the scenario is to see if you can remain calm in a stressful situation and deflame the scenario, not fuel the fire. So don't take anything personally. It's all part of their job to make you feel bad no matter what. And lastly, do your research and know your surroundings to be mentally prepared. So this is so important. If you know that there will be 10 scenarios, you'll be ready to be acting for 10 scenarios. And in your mind, you'll say, well, I think I screwed up the first one, but I have 10 left or 8, 9 left. So I'm going to reset and then keep going. And that will just keep you prepared. The other thing is knowing your surroundings. So where will your interview be? Will it be in a hotel room? Depends on the school. They might not have the facility to have a bunch of rooms, one after the other. So are you going to be in a coffee shop? Are you going to be in a hotel room where you're going from one room to another? McGill, for example, has the Sim Center where I practice my medical stuff. So I have my mock codes, mock CPR there. So there's medical supplies all over the walls, and there's a sink, and there's a hospital bed, and there are one-way mirrors. So if you're in a scenario with your friend or your boss, it's going to be kind of weird having a call button on the wall or a sink on the wall. So if you know that in advance, you'll be able to mentally block that out and continue just focusing on the scenario. And don't get scared by the one-way mirrors. I want you to remember that everyone evaluating you is a human being, okay? They all have kids, they all have family, they all have a dog, they all go to the bathroom, they all eat dinner, they're just regular people. And I want you to think of them like maybe not your parents if they stress you out, but your friends, your family. And if you just keep that in your mind, you'll think you won't be so intimidated by them. And just try to block out that one-way mirror and don't look at it if you can. Focus on the actor, focus on the human in front of you, and focus on the scenario. Let's see if I can, okay. So now, a lot of people ask me, what are they testing? And every station has a point to it. And the point of the station might not be what is written on the door. So for example, if it says, go in and complete this crossword puzzle, the task might not be to complete the crossword puzzle, but to see how you think about the crossword puzzle. And people will try to, or they'll get stressed if they don't finish the task in 8 minutes, instead of focusing on what they're testing. And I want you to remember these skills that I've listed here, because these are the skills that I am tested on as a resident and as a medical student. So I'm going to give you a better picture. So these are just the list, but here's the actual picture of it. And it's called the CanMEDS rules. And this is what I'm evaluated on every time I see patients and every time I get feedback from my staff. It's from the Royal College of Physicians and Surgeons of Canada. And these are the skills that they said, well, if this is how a good doctor should be, let's test the people getting into med school on these skills. So every station that you will have will be based on one of these skills. Either how well you communicate, how well you work in a team, how well you can manage either stress or tasks or different people. And that could be in a question, for example, like, how would you plan out this event? And do you focus on just one aspect of the event, or are you able to manage all the aspects, like the funding, the food, the tables, how are you gonna have transportation? All of those different things are testing your managerial skills. Then there's health advocate, which is basically if you advocate for people. It wouldn't be tested in the MMI as a medical task, but for example, as your friend has her mother was just diagnosed with breast cancer. Are you going to help them, or are you going to focus on yourself, or how are you going to handle the situation? Or if an old lady has to cross the street, that's the kind of health advocate. But of course, you won't be on the road during your interview. Then there's scholar. So for me, that's looking up studies, looking up different types of diagnoses and things like that, how well I can look up information. And for you, that information would be presented to you. And you would be given an article, or you would be given a piece of information, and you would be asked to assess that piece of information using objective discussions, objective points. So that's another common scenario that comes up, and you should be practicing on, I recommend getting an article, a medical article, and then take a piece of paper and write down 4 arguments and 3 con arguments, and then summarize your statement. And it might be written or it might be vocal. So just keep that in mind. And the last one that's tested in every station is professional. So are you professional? Are you someone who shows that they're biased or they have problems with certain types of people, like racism or sexism, and those are red flags. So they'll try to put you in a scenario where you're uncomfortable, where you're dealing with something that's a bit taboo or a bit, not talked about, or might be out of your comfort zone. And they want to see how you react. Are you going to be judging them, or are you going to be open? So even though I might think something in real life, at work, I always have to be open and treat everyone the same. And that can be tested in any situation in your professionalism. I'll give you one more example before we go into the scenario. So if you had to teach, a lot of times it would be a teaching station where you have to teach something. And what would they be testing in that sense? They'd be testing your communication skills and also your professionalism. So just an example, if you had to teach an older person how to do something. Older people tend to be slower. They tend to not catch on as fast as we do. We're like the technology generation. We go super fast with everything. Can you be patient? Can you be professional? Or do you get frustrated and start to, change your tone and get impatient and try to do the task yourself instead of allowing the other person to do it and teach them how to do it? So that's one way they would be looking at your professional skills. So before I move on to the scenario, does anyone have any questions? And when you type your questions in the chat box, everyone can see. So make sure it's a question you want other people to see. I'll wait 30 seconds. No one has questions? Yeah, that's a very good question. So Alka asked, can they ask problem-solving questions? So very good. So it's going to be something random and ridiculous that is impossible to solve. So like I gave the example the other day, how many snowflakes are in a pile of snow? How many molecules of oxygen do you breathe per second? How many skin cells are on your head? Ridiculous questions that I don't know the answer to, but they will tell you that they want a number. And this will freak people out. People will get stressed and basically will give up. And that's what they want to see. They're evaluating whether, first of all, you give up, and second of all, whether you make a reasonable attempt. Okay? So they're looking at your communication skills and professional skills again, because if you start laughing and you're like, oh, what is this? I can't do it. Is this a joke? Versus saying, okay, well, I'm going to take this seriously and do my best to answer your question and be as clear as possible. That's what they're looking for. So you should always make a reasonable attempt, even if it's ridiculously impossible. And if they want a number, give them a number. And if they don't give you details, then make up the details. So if they, for example, asked you how many molecules of air do you breathe a second, you can say, well, based on Avogadro's number, I can assume there are over 1 billion particles of air in a millimeter, and I guess I breathe in, 50 milliliters of air a second. Therefore, I would do 50 times 1 billion, which would be 50 billion, and that would be my answer. And just by seeing your train of thought, that's how they would evaluate you. And if they don't like it, then they'll say, well, tell me another way. Or how did you get this number? How did you get that number? And they'll keep you busy for the 8 minutes. That's their job. Does that answer your question? Very good. So JH is asking, how much background knowledge about the healthcare system should we know? So you're not expected to know medicine. And if you know about the healthcare system and about the health laws specifically, you probably know more than I do. So what they're looking for is basic knowledge. Okay, so if you're interviewing in Quebec, you should know that there are CLSCs. You should know that you need to see a family doctor before you can see a specialist. You should know that maybe about the PREM system here, but I really wouldn't worry too much about it. What I would focus on are any current issues that are changing medicine right now. So not regarding drugs, but regarding policy. And one thing that is all over the news now, does anyone want to take a guess? What is like the biggest thing in medicine with Gaëtan Barrette right now? That's one thing. And that's been around since Pauline Marois. So they could ask you about that, and that could be an ethical question. Right, so what about family medicine? Anyone know? Yeah, there's always a shortage, but that's a different issue. But what they're talking about right now is Bill 10 and Bill 20, and I'll type it here. Okay. And I don't know very much about these, to be honest, even though they're probably going to affect me the most. But what you should know is why people are so upset about them. And if they ask you about the healthcare system, they will give you pieces of information. So they'll tell you Bill 20 was tabled by Gaëtan Barrette to reduce the salary of any family physician not meeting the quota of 2,000 patients a year. The average, and then they'll tell you the average patient load of a family physician is 500 patients a year, and the average salary is this, and he wants to have a 40% reduction of anyone who doesn't do this. And then you have to comment on why this is good or bad. So I'll just tell you a little bit about it. The reason that people are so upset is because uh, it's taking away respect for family physicians who don't just do clinics. Family physicians work everywhere. They deliver babies, they work in the hospital. And in the hospital, they may not be seeing one patient every 5 minutes like they do in the clinic. And they're seeing really sick patients who take more time. And then those family doctors would get deducted on their salary. And people are just very upset about that. So I would read about those two things. But other than that, anything that they will ask you about, they will give you some sort of information beforehand, and you can always ask questions. And if they don't answer, you're always allowed to say, well, I'm not 100% sure. I don't know very much about this, but I'm going to use what information you have given me in order to come up with the best opinion possible. And if I were anywhere else, I would be doing research before giving an opinion, always in order to provide the best opinion possible. And that sort of covers you to show that you're professional outside of an MMI setting. I'm going to move forward just because time is flying. I don't recommend to read books. I really don't. MMIs are case-based, they're actor-based. Farah asked if there are any books that would be useful for the MMI. You should be living life. You should be going out. You should be talking to friends who might have a problem, and you should listen to them, and you should see how you help them, and you should use all of your experiences and reflect on all of your experiences that you've done up until now in order to tell yourself and convince yourself that you have the skills to ace this MMI. You know how to teach, you know how to talk to people, you know how to listen, you know how to do a group project, you know how to manage multiple things like your family going crazy, your dog, your homework, your lessons, your soccer practice. You know how to do that stuff. So just focus on all the things you've done. Go over your CV and your cover letter in order to convince yourself of that, and work on your confidence. Your confidence is 90% of your interview, and your calmness, confidence and calmness. Okay, so let's go to the scenario. I want you to read it. I'll give you 2 minutes and then we'll talk about it. So go ahead. Okay. Wasn't really 2 minutes. But in real life, so good question, George. So George is asking if this is a discussion station or if we're acting with a boss. So it really depends on the school, their funding, and whether they have good actors. If they have good actors, this can easily be an acting station. You'll walk in and your boss will say, why aren't you here? I'm going to fire you. You have this empty pizza again. You stopped to help someone and now it's free. And they'll start just ranting at you and you have to calm down and take a step back and calm the situation down. So it can definitely be an actor, okay? And then if they don't have actors or they want to really just assess how you go through a problem, it can be one-on-one. So either way. So yeah, you're a pizza delivery worker. Oh, sorry. You're a pizza delivery worker, and I guess it would say you are instead of Joe, okay? To make you feel less weird because you don't have to act like a guy. So basically, this is an ethical scenario, and it's looking at your problem-solving skills. And before I tell you which one specifically out of the list, does anyone want to take a guess out of which of those skills is the one that they're looking at here? I can go back if you want. Yeah, but out of these? Professional always, communicator. So yeah, communication, if this were an actor, definitely how you communicate, how you calm down a situation, how do you remain professional for sure. And then also health advocate is a big one here because you're saying, do I keep my job or do I go to see this and help this woman? So there are a few ways you can approach this, okay? Basically, you have this job and they'll give you a whole bunch of details. And if it's a one-on-one scenario, you might want to walk in and summarize the scenario. So you say, okay, so this is the scenario. I'm a pizza delivery worker, and on the way to deliver pizza, I see a woman on the street, and I know that if I don't come back, I'm going to be fired, but I need this job. So here's what I would do. Okay, how many people would not stop? How many people would deliver the pizza and keep his job? So I guess most of you in real life might not stop. Right, if someone helps out, yeah, and you may call 911, you may say, well, I don't know what to do here, and you may continue. But in the real, testing scenario, obviously they're looking how you would help and why you would help and what you would do about your boss, right? But for sure in real life, that may not be the right case. So there is a sense and there is an aspect of acting here and saying the right answer, even though in real life it might not be exactly how it would work out. But this is like the only scenario, the only way it can happen. So you have to answer it that way. It's the same thing if they asked you an interview question. That's how you would practice. You'd say, well, I'd have to stop. But there are a few things you can say. So one thing before answering a question is always summarize in your head. Take the time to think, and you have the time at the beginning in your 2 minutes to do that. So you say, well, if I get fired, I lose my job. And you can break it down into the two different scenarios. You can say to the evaluator, so let's say I help the woman and I'm able to help her, and I wait for the ambulance, I don't get the pizza delivered in time, and then I have a chance of losing my job. But at the same time, I'll know I had done the right thing, and there may be a chance that I could convince my boss not to fire me if I were to explain the scenario. In addition, you could say, and if that were the case, what I could also do is, if the money is such a big issue of one pizza that I failed to deliver in 30 minutes, I would just pay for the pizza, because that would satisfy my boss's financial needs and also satisfy my humanistic needs not to leave this woman lying on the street by herself. and that shows conflict resolution. And if this were also an acting scenario where he's yelling at you, saying, you're going to be fired, you made me lose money, you need to put yourself in his mind. Forget why you did it. Forget why it happened. But in his mind, he's the business owner. He needs his money. And you tell him, look, sir, you need your money. It's clear. I understand that. I will pay for the pizza, but I would like to keep my job. Always say that the other person is right. And that will get you out of a lot of situations instead of protecting your ego and saying, no, I was right. You can't fire me because I did the right thing. I did the right thing. No, just say, you're right. I didn't do it. I was late. The pizza was free. But what can I do? What about the good? Yeah, that's another argument you can make to him. Anand said, what about good publicity? You can say, well, sir, I was late, but at the same time, the car was next to her the whole time, and there was a big crowd, and everyone saw the pizza logo. So please, I just want to keep my job, and I'll pay for the pizza. So good. And you make those kind of arguments in his favor, in the boss's favor. Don't try to protect yourself. Try to fix the situation. And then you can go on to say, and what if I do deliver the pizza and and I don't get fired, but I wouldn't be able to live with myself knowing that I didn't help this woman and not knowing what happened to this woman. And so you could say from the beginning, so my decision would be to help the woman, but the challenge would be what to do afterwards. How would I handle the situation afterwards? And that's what they're looking at. They're looking at if you can go in depth. Can you go beyond the situation in front of you and analyze the consequences afterwards? Okay? So it's not a question of do I help or not. It's a question of when I help, how will I deal with it after? What are the options and problem-solving tools I can employ in order to keep my job while still doing the right thing? And if in the end I'm fired, well, then I wouldn't want to be looking for a boss that doesn't understand this kind of important issue in the first place. And I will find another job because I am confident that I have the skills to be a good employee. And if you answer like that, you will ace it. Okay? Just remember they're looking for your ability to analyze right or wrong, and then your ability to assess your consequences afterwards, how you'll deal with the consequences afterwards, diffuse the situation, make the best of the situation, and do the right thing. Does that make sense? Good. All right. Any questions about anything in the last few minutes? No problem. I wanted to know if this is a good time for everyone, because we'll do this again next week for sure. And I want to know if there's something specific you'd like me to go over next week. Good question, Matt. Matt had a question if it would be a gigantic paragraph that would take 2 minutes to read, or will you be able to think about it? During the day, we can try. I'll send out an email about the timing. I'll just answer this last question. This was sort of an ethical question, Farah, but we can do more because I think that's what people are most worried about. To answer your question, Matt, about being a really long scenario, if they do that, it's to see how you synthesize information. So that's sort of a scholar test as well. So if they give you this gigantic paragraph that you have to read really quick, then they want to see, can you pick out the 3 pieces of important information and go ahead with the scenario? Why is that important as a doctor? Because I get a chart that's 20 pages long, and in 3 seconds in the emergency, I have to go through and figure out what's going to kill this person if I miss it, and what do I need to know right now? And if I'm able to pick out those important key information, then I'll be able to treat my patient well. So they're looking for that. Surprises in the room. Are there sometimes surprises in the room which is not given on the paper or door? There could be. For example, it will say on the door, go in and complete the task. And you'll stand out there for 2 minutes saying, oh, what is this? And you get inside and then you have the task. So that would be how that would happen. Or it would say something like, your friend Billy is really sad. And you go in and you find out that, I don't know, he just came out to his parents and they threw him out of the house, so you might not have been prepared to deal with that, even though it just said on the door, go help your friend, so those are the kind of surprises. You guys have lots of questions. As far as, is there any writing task? So yes, this could have easily have been a writing task. Mental math, yeah, like the example I gave about the molecules. So you'd have to come up with numbers, and if you have to come up with numbers, just come up with easy numbers, but they won't give you a math question, that's for sure. Or they'll give you like this really impossible math question that you have no idea how to solve, and you'll try to figure it out using the same method we talked about. So breaking things down, making it simple, and yeah, unfortunately, I cannot be mean and condescending. So Alka said it would be useful to see a really hard problem where the interviewer is really mean and condescending. They can be. And in fact, I had a friend who did their interview and didn't get into medical school because he took it personally that the interviewer was condescending and being rude to him. So he was rude back and he didn't get in. So just remember, if anyone is mean and condescending, it's because they have been told to be mean and condescending. And your job is to smile and keep smiling and let all of their comments go over your head, not into your heart. Okay? Because as soon as you let it affect you, as soon as one little comment pierces your ego, you're going to change your body language, you're going to change your tone, and it's going to go through your whole interview, all the other stations, and you won't perform as well. So just remember, you're awesome, and the actor's job is the actor's job. It's not a reflection of their feelings towards you. And for fun, you can ask your friend to start yelling at you, or some random person to just yell at you, and see how you take it, and see if you're able to just stay calm and stay happy. Because that's really the best thing to do, is not let anything get to you. If you can do that, you'll be good. So I'm going to end it here. I'll send out an email asking you to rate the session and also to coordinate the next meeting. This has been recorded, so hopefully it worked, and if it did, I will be posting the video on the MedCoach website and you'll be able to have access to it. Okay? So have a really good night, guys. Enjoy your weekend. Go out and have fun and have some great MMI practice experiences in real life. And good luck on all of your interviews. Good night, guys.